Thank you so much for joining me here today. I am here to give a little what to expect about pregnancy and delivering, and to try and tackle some of the myths that might be out there and give a real scoop, right? So if you've listened to our podcast before, you'll know that I've had 4 babies. Oh my gosh. So a lot of this is coming from personal experience, but also as a pelvic floor physical therapist. This is our bread and butter. It's what we talk about all day, every day for those that have had babies or are thinking about having babies, and even a lot to people who have never had babies. But this particular episode is all about prepping for baby and how to take care of yourself after. Oh, there's so many things. So many things. Obviously, when in doubt, ask your provider. Number one thing you can possibly do is talk to your provider about different things that you're experiencing and symptoms. Some of the symptoms that you might be experiencing that you should be talking to your provider about are a feeling that something is falling out of you. So that's what we associate with prolapse, a heaviness in the pelvic floor region. It can be very common with pregnancy and especially right postpartum. Prolapse is, and you can look at other episodes that we have specifically about prolapse. And for those of you watching, I have a little demonstration here, but it's when, so you have your rectum, you have your vaginal canal and the uterus up top, and then your bladder on the other side. And prolapse is when one of these organs is sinking into the vaginal canal. So a lot of times after babies, or even during babies, and sometimes more towards that 3rd trimester, you'll actually be able to feel or see something coming through that canal. It's extra common if you have pushed a baby out, just because if you're pushing a baby out, you're also pushing other things out sometime. And this isn't meant to scare. It doesn't happen to everyone. I think I've shared that I have a grade 2 bladder prolapse, and it is what it is. I don't have any urinary incontinence, so no leaking. I have no pain. Sex is fine. All of the things. So it can be totally asymptomatic or symptomatic depending on what you're experiencing and how it's all going. So I just want to touch that. Prolapse is something that can happen with pregnancy and specifically after delivery. It can also happen even if you have a cesarean, and that's because you've been literally carrying a bowling ball of weight that is just growing and sucking the life out of you for all of these many months. And just that extra weight on there makes you more prone to prolapse. BMI or body mass index can be a risk factor for prolapse. Simple things like diet, chronic constipation, especially in that postpartum phase. So there's some things that can make you more prone to it. For example, people with Ehlers-Danlos syndrome, where their ligaments are more loosey-goosey, they tend to be a higher risk for prolapse symptoms. So prolapse, something that can happen postpartum, something to pay attention to. And then incontinence. So all of these things might be really common, but there are so many different things that we can do to help with some patients who multiple pregnancies, and they're like, oh, I know I'm pregnant because I instantly start leaking. I'm like, really? And it's true. It's just can be an effect from hormones and how your body responds to that. So incontinence can be leaking urine. It can be leaking feces or poop. And we've talked about all of these in other episodes, but this is just specific to that perinatal period, which is pregnancy and then a little bit after pregnancy. And because of all of the different hormones and what they're doing to help you create this amazing life, things can just get a little bit altered. So that's where urinary incontinence can definitely happen and be pretty common in that. So just something to pay attention to, especially in the postpartum, right after you have a baby. That's when you tend to be the most constipated. So making sure, I know a lot of people don't like to take any additional supplements or anything, but I cannot emphasize it enough. And whether it's a natural supplement or a specific stool softener that your doctor is providing you. Yes, and yes. Making sure that you do not have constipation, especially if you've had pain meds on board through the delivery. You tend to be on the more constipated side, but your pelvic floor has already just gone through so much. We can call it trauma, but work trying to expel this baby, whether that was cesarean or through the vaginal canal. And either way, it's a lot of work on that pelvic floor. And the least thing that you want is for your pelvic floor to have to do that much more by trying to expel and carry around a big, huge poop. So making sure your fiber, your water are all really important. And then taking whatever supplements can make sure that kind of all comes out. And even in the pregnancy phase, constipation can be a big issue to the point where supplements are a great way to do it. Also, making sure that you have enough water on board, the things that we can control without having to take medication. Water, huge. Exercise, getting that body moving is going to help expel some of the constipation also. And then we talked about it in the poop episode, but the I Love You massage. So really just trying to get your system moving in whatever way feels comfortable and doable. The hardest part about the I Love You massage when you're pregnant is that you're pregnant. So there's a huge baby in there that's altering your ability to work your large intestine. So paying attention to the other things that we can control a little bit more with the constipation. Super, super, super common. So we go squatty potty, we go water, we go high fiber, and movement. So very important to pay attention to those big factors in managing constipation early on and in that postpartum phase. So incontinence, prolapse, sex. Let's talk about sex. Everyone has a little bit of a different feel on this. Some people are totally like, nope, I don't want to have sex. I laugh because I heard this a couple of times. I just don't want the baby's head getting hit by a penis. And if that's the kind of sex that you're having, I can tell you that the baby's head is not getting hit by a penis, even though it might feel like that because it might be so low in the canal. The truth is, you have to be able to meet your body where you're at and meet your partner or not partner and yourself where you're at with it. If you feel comfortable about it, great. There's multiple different positions. I have never experimented so much with pillows in all different places while being pregnant, just to feel a little bit more supported, but also being able to still engage in that activity. And with that said, masturbation is also great. A lot of times people have increased sex drive while they're pregnant. So it's funny. People either increase sex drive or no sex drive at all. And if you are having increased sex drive, great, get it on. But just making sure that we stay safe, especially with all safe sex practices. So making sure that you're trying not to get a UTI, basically. So going pee after having sex is a big one, especially with pregnancy. Making sure that you're wiping from front to back if you're a vulva owner. All of these different things just to try and minimize the amount of bacteria that could be getting into your system. And of course, if you're having any reaction to anything, talk to your provider, right? Those are the classics. But sex can be super fun and things just feel different. They feel so much different. So playing around with that can be an experience. And then I'm trying to decide when to break into the postpartum. So let me address sex again in the postpartum part, but really quick, getting ready for labor, all of the different things that you can do. One, very awesome and great for your body to stay physically fit. So whether that's continuing to run, we can talk more about that. Walking practice is amazing. Swimming, unreal, stationary bike, or your yoga practice, or Pilates, or online. Weight training is a great idea, especially if you're not having any increased urinary incontinence or prolapse symptoms. Then if you are having increased symptoms and engaging in those activities, then that's what we need to talk about, right? We need to figure out how we can better manage your pressure system so that you can still be engaging in some of the activities that you want to, even though you're pregnant. Again, it all just needs to be done safely, but there's amazing literature out there right now that supports staying physically active while being pregnant. Great for cardiovascular health, neuro health for yourself, but also for your baby. So I'm a huge proponent of physical exercise, especially while pregnant. Getting closer to delivering, however, the go-tos, perineum mobility exercises. So super exciting. For those of you who are watching this, just showing you where the perineum is. So it's right past the vaginal canal towards it's the space in between the rectum and the vaginal canal. And what you want to do is it's right at what we call the introitus, or the opening of the vaginal canal. And all you're doing is just pressing posteriorly, so towards your rectum, and helping guide that tissue. So whether you're doing this with coconut oil, lubrication, any kind of safe vaginal product, to olive oil, just to be able to massage that tissue. This can be done by a partner. It can be done with a toy. It can be done just with your thumb or finger. It's hard, especially when pregnant, to get down there. So I often recommend using a toy or a pelvic wand to be able to get in there. I have a funny story about a wooden spoon that I know someone used. This was a long time ago, and maybe they didn't have as many toys or different things that you can use, but I can't look at her wooden spoons the same. But just pushing posteriorly on that canal, couple minutes, couple at least, especially getting closer. I don't typically recommend even starting this until at least 4 weeks until delivery, but more like 3 weeks. And just seeing if you can't increase a little bit of that mobility, because that tissue most likely will be gently stretched. And this is just a little bit of prep to help with that. Let's see. Perineum. Oh, all of the things, getting ready for birth. It is a scary and amazing time. And we could do a whole episode just on body mechanics of lifting and carrying and sciatic nerve during pregnancy. These are all things that can, back pain, holy moly, swelling, right? So if you are having increased swelling, definitely needing to talk to your doctor, but also just practicing, making sure that you are laying down and more frequently throughout the day and just doing things in shorter bursts. And that becomes a big thing at the further along in pregnancy as you get, is you can be up and doing things, and then it's okay to take a break and just take a moment, get off your feet for a second, see if that can help, and then get back up and do it. So pacing things out can be very important and helpful. What else did we talk about? Oh, just sleeping. Oh, yoy. Sleeping while pregnant is just, it's just rough. It's just so rough, because there's that time where you feel like a beached whale, and any kind of movement, especially when you're trying to sleep, is just hard. It's my go-tos, at least, and that's where all these fancy pillows come into play. They say sleeping on your left side is the most advantageous for pregnancy, and that just has to do with heart and blood flow. That might not always be the case for people because they might not be as comfortable. So just trying to turn, because laying on your back when you're that pregnant is typically not as advantageous. So I recommend this to all my patients, but sleeping with a pillow in between your knee and your ankle. A lot of people will put it higher up towards their crotch. In fact, my husband calls it my crotch pillow. But keeping that pillow between your knee and your ankle actually helps with your hip distance. So you're taking up that space so that your hips aren't flaring in or they're flaring out. They're at that neutral degree. So sleeping on your left side, pillow between knee in the second trimester. I always like to put a pillow underneath my belly because I wasn't super big yet, but big enough to where I had to like either lean further over, and then it felt like I was like laying on my stomach. So it was really awkward. But so just putting kind of laying on a pillow right there to take up that space always helped. And then I would actually, so I'm laying on my left side, pillow between my knees and my ankle, pillow underneath my tummy. And then I'd like wedge a pillow in my back because I wanted to turn on to my back so much. So I would wedge it there. So even if I tried to turn, I wouldn't be fully on my back. So I slept with all my babies. And that's just while pregnant. Then there's the whole postpartum part of it, right? Understanding in the postpartum phase how to manage everything. So let's jump into that. So some common things that you can experience, especially right after having a baby: hemorrhoids, constipation, can be perineal tearing, might be cesarean scar management. You're trying to manage breastfeeding. You're trying to manage bleeding. You're trying to manage maybe prolapse symptoms and incontinence and then a baby, right? Then you're also supposed to be taking care of this brand new little critter that there's no manual. There's no manual for any of it. And it's so frustrating. So they make amazing kits that you can get. I loved the witch hazel aloe pad. You can literally just get a pad, a really big pad. And this is for the postpartum swelling that can occur. And they'll talk about this at any prenatal class. And hopefully your fabulous nurses or doulas or midwives will be able to, or doctors will be able to help you within the postpartum phase. But making sure that there's some kind of a cold compress that has some other healing properties can just feel so good on your vulva. I'm telling you, your vulva and your rectum. It's real. It's totally real. So making sure that you have a management, and typically if you give birth in a hospital, they'll give you ice pads and things like that can be very helpful, but it's often advantageous to have some of those at home as well in the freezer ready to go. I loved doing some meal prep or a meal train. This last pregnancy, I was so blessed to have such amazing friends and family and community to help manage 4 kids and healing postpartum and all of the things. Those different things can be advantageous if that is at your disposal. Managing hemorrhoids. What do we do to manage hemorrhoids, especially postpartum? Don't get constipated. I know that's easier said than done, but it can't be more important than in that postpartum period. That first poop, so terrifying sometimes after having a baby because you've just experienced so much pain sometimes and trauma sometimes to basically an assault to that area. And so then having to have a bowel movement is that much more challenging. So squatty potty for life. If you are in the hospital and they don't have one, grab the trash can, flip it over, put your feet up on top of it, get into that position and breathe, right? On that exhale, being able to exhale and manage those symptoms instead of bearing down. Because if you're bearing down, you're helping to push other things out, which might be your hemorrhoids or increasing some of those prolapse symptoms. Those are the big things. And then any kind of hemorrhoid cream is going to help. And your doctor will be able to prescribe some. And if that isn't in the wheelhouse, you can get over the counter stuff. That'll be very useful. But just trying to calm down as much of the swelling and the inflammation. I'm not a huge, I don't take a lot of drugs, but especially postpartum, ibuprofen. If you can take that, real game changer just to help manage the swelling and just inflammation in general. So if you are having to do this C-section scar or perineum scar or labial scar or wherever that scar, you're having to manage a wound also. So that's where it can be scary and it can be painful, but making sure that you're doing all of the things to help which are breathing, bracing. So putting external pressure sometimes, and it might not seem like that can really help, but putting external pressure on that scar, if transitional movements are painful, that's a huge one that can help. So if it's your perineum, just actually putting your hand over your clothes when you're having to, say, stand up can be very helpful. The hardest part is then you're putting pressure on that, but then you're also maybe having to lift a baby. What I recommend is if you're sitting down, putting your baby to the side, bracing to stand up, and while you're exhaling, standing up, and then exhaling and lifting your baby, or asking for help. If you have help, use it. So important to be able to ask for help. That's a hard lesson, but it is a very important one. So in that perinatal postpartum phase, bracing, if there is scar tissue, typically we recommend, if everything is healing appropriately, you can begin scar tissue mobilization, which is actually working on that scar tissue gently as soon as 4 weeks postpartum. And that's just really going to help decrease the formation of additional scar tissue and getting that tissue healing a little bit. A lot of people ask, how soon should I see a pelvic PT? It really depends on your doctor and your conversation. If you've seen a pelvic PT prior to delivery, then I will see people as soon as a couple days postpartum, just to make sure that the healing is going okay. We're not doing internal exams. We're not doing any of that, but we're just helping with body mechanics and functional mobility and trying to manage symptoms. If you're having back symptoms, new ways to pick up different things and just manage things around the house, but as well as how can we better manage urination and defecation. The other question, when do we get back to sex? And every doctor will tell you that you will go in for a doctor's appointment and you will get cleared or not get cleared at that 6 or 8 week mark. That's a good rule. You have a lot of healing that has to be done. So it's pretty important to give yourself a little bit of grace with that and allow the healing to happen. I have many people who they're like, what? I feel fine. I'm totally good. Great. Your own body, trust in that. I think that is the biggest thing. But also don't be afraid to ask your medical provider if it's safe at that time. The other thing that I want to advocate to people is to have a pelvic floor exam in that postpartum phase, whether it's by a pelvic PT, whether it's by your doctor or midwife or nurse or medical professional. We just want to see what's going on. Is there prolapse symptoms? Does the healing look right? Is there any continued pain or discomfort? All of these different things. It's so important because it often is something that they say, oh, yeah. Oh, good. You'll be fine. Yeah. Oh, yeah. You're going to leak. Oh, yeah. That'll get better, I think. Let's confirm what's going on, and then we can figure out if it's going to get better or if there's additional things that we need to be doing in order to help with that. So don't get blown off like that. That's a big one. And you can always ask for it. Hey, can we just do an internal exam? It's never something that people really want to do, especially postpartum, but it's pretty important for the information that you can gather. So it's something to pay attention to. The other thing, and again, it goes back to the breath. Anytime postpartum, breathe. Just that exhale is so important when moving. I cannot emphasize that enough, especially in that postpartum phase. One thing that I always really liked was a belly band. After cesareans, they give them to you typically, and you can buy all sorts of different ones online. But there's this jelly phase postpartum where it just felt like things were like really wobbly for me. And having something that was bracing just helped me feel a little bit more secure. It helped me feel like I could manage pressure better and even feel my body a little bit better, because there's definitely an uncomfortableness of, holy moly, okay, I don't have a baby in there, but it still feels like I'm have a baby in there. So all of these different kind of things to manage. So compression was my friend. And I wouldn't wear it all day. I would just wear it for maybe a couple hours, take it off for a couple hours, put it back on for a couple hours, just to help that blah, blah, blah phase of feeling. The other thing that I advocate, especially, okay, so returning back to sex, right? When, how, oh gosh, some people don't return back to sex for years, and that's okay. Some people, like I said, get back at it 4 weeks postpartum or sometimes sooner. So wherever you are at with that, my recommendation, and again, some people are not comfortable with masturbation, but I always recommend check it out. Check out what it all feels like first before you engage with a partner. What do my labia feel like? What does my introitus, or the opening of the vaginal canal, feel like? What does my rectum feel like? What do all of these different body parts, and can I orgasm? Is orgasm painful? Have things changed a little bit? Knowing all this before going into intimacy with a partner can be very helpful, because it just gives you a little bit more familiarity and understanding and communication, talking points that you can really say, okay, so these are the things that I really want to pay attention to, because they might be a little bit tender and I want to be able to communicate with you about these. So very important to talk about sex and any tender point. And maybe you masturbate and you're like, oh gosh, nope, I can't do this yet. Great. Isn't that great information? Information is key, right? Education is power. So just paying attention to that, especially in the postpartum phase, not getting constipated, good body mechanics, especially if you are breastfeeding or not breastfeeding and pumping, or if you've decided not to do any of the above, you are still going to have a lot of extra weight up here for a while. So managing your back position and posture is going to be so big, because, oh man, those shoulders hold a lot of extra weight and a lot of tension. So making sure that you're doing everything you can, even if it's asking someone to give you a shoulder massage, right? Different things just to help decrease some of that tension. I'm just trying to think of other things that people don't talk about that are really real in this postpartum phase. Oh, night sweat. So insane. Typically for me, it was like a week after giving birth, just drenched the bed. Waking up in the middle of the night, and this happened with every single one of mine. Waking up in the middle of the night to the point where I have soaked, I'm so sweaty, I have soaked through everything. I literally have to change the sheet. A couple of times I was so just exhausted, because you're trying to manage the sleep deprivation because of waking up with a baby and just your hormones and all of the things. But they call it the hormone dump, and not everyone gets this, but you just sweat. You just prolifically sweat through everything. Sometimes I would just put a towel down. I just have towels and I just lay the towel down and try to sleep the best I could, because anything was better than nothing, just to get through those first couple weeks. Yeah, so that's real. It's something to pay attention to. And then realize that the emotions are so wild. There's highs, there's really high highs, and then there's really low lows. And it's this constant fluctuation while your hormones are just trying to regulate. It can be really scary. And that's where a mental health practitioner or talking to your primary care is huge. Talking to your friends, communicating with your partner, whatever it is, but just having those open lines of communication is going to be really important, because there's a lot going on. There's a lot of emotions and a lot of new experiences and things to manage. Even if it's your second, third, or fourth kid, you're still bringing a new baby home, even if you think you have everything figured out. It's always different. Each being is different and each new dynamic is different. And it's all having to be figured out and created at that time. After my first baby, I was like, oh, yeah, I got this. I got this delivery thing on lock. No, it was night and day delivery. And each subsequent child was after that as well. So just when you think you have it figured out, I'm sorry. I'm really, but you don't. And I think that's one of the hardest parts is the control aspect of it, of how to let go of the control. Whew, just sit with that for a second. How do we let go of that control in that phase? Pretty challenging. The dishes are going to pile up and the laundry is going to pile up, and you're still going to maybe just have to sit there and breastfeed. So it's fleeting. It really is. And it might seem like you're never going to sleep again. And it might seem like you're always going to be in pain and you're always going to be peeing your pants and you're just like bloody from all of the post-birth stuff. And that does change. It really does. I can't emphasize that enough. And I'm not saying grit and bear it. I'm saying ask for help because it's super, super important to be able to communicate about that. But there's no kind of other way around it. It's blissful and it's so hard. And you're ecstatic and you're sad and tired and unsure about every moment of what you're doing. So the best advice that I was given, and it took a couple of babies for me to figure this out, but just take a deep breath and sit with it. Shoulders drop. Everything just changes. So whether that's in the middle of the night while the baby's crying and you can't get them to calm down and you're bleeding and sweating and in pain and you can't roll over because your C-section scar hurts, stop. Take that moment, take that breath, and then reassess and then advocate for yourself and your baby and whatever else you need to be advocating for. Postpartum phase lasts a really long time. If you've ever had a baby, you're always postpartum. There's always different things because our bodies change so much having babies, and that can be scary, but that's the truth. You're always postpartum. The other big thing before I sign off is when to get back into exercise, when to get your body moving again. Do it. So even just starting with gentle walks, right? A couple weeks postpartum is okay, depending on your symptoms, depending on the conversations you've had with your doctor or your healthcare practitioner. Gently moving your body is going to be very advantageous. As we move, it helps with the swelling. It helps with blood flow. It helps with healing. I can't advocate it enough. And people are always like, okay, but when do I get back into my running? Or when do I get back into lifting my heavy weights? It's just like you are completely untrained for a new event. You don't just jump in and run that marathon, right? You start by running 1 mile and checking in with your body and seeing what the training program really is talking about. So all of these things are just going to take baby steps. And it's so hard because some people want that post baby. They're ready to get their bodies back, ready to have it feel a certain way. And it takes time. And I wanted to punch everyone in the face whenever they said that. And I wanted to punch myself in the face when I'm saying that to other people. But I truly believe that if it's an uncomplicated delivery and you're having to do that postpartum period, give yourself a year. Any subsequent babies after that, add 6 months. Your body is just still regulating. It's still healing. There's so much going on. That relaxin in your body is still present and you're loosey-goosey, right? Your chest has changed, right? Your pelvic floor has changed. Everything has changed. Giving yourself grace and asking for help is what I advocate the most. Hopefully that's it. So wish me luck. I'm going to go speak at a conference this weekend all about perinatal health and mental health and the effects on rural and marginalized communities. I believe it's going to be one of our podcast episodes as well. So stay tuned to that. And in the meantime, if you are perinatal or postpartum in this phase of life, congratulations. And maybe you don't want to hear that, but whatever it is to you, it is a journey and you're riding the wave. And thank you again for tuning in to the V Movement.
There is a lot of great information in this episode. If you have a friend or someone you know that would benefit from this episode, please share it with them. Thank you all for listening, and we appreciate your continued support. If you haven't already, please subscribe or follow us wherever you are listening to your podcast, and you can also follow us on Instagram at @the_v.movement. Until next time, keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.